Measuring respiration and pulse. Required supplies: stopwatch, record sheet, pen, cotton swabs, if needed. Caregiver preparation, neat appearance. Wash hands thoroughly. Ensure the elderly person is emotionally stable. No exercise within the past 30 minutes. No signs of anxiety or stress. Verify the elderly person's bed number and name. Explain the purpose of the procedure to the elderly person. Position: elderly person in supine or sitting position. Body relaxed. Wrist extended, arm placed in a comfortable position. Step 1. Measure pulse. Caregiver uses fingertips, index, middle, ring fingers to press radial artery. Apply moderate pressure. Ensure pulse is clearly palpable. Note pulse strength and rhythm. Normal conditions. Count pulse for 30 seconds. Multiply reading by 2 to get pulse rate per minute. For example, 96 beats per minute. If the elderly person has pulse deficit, 2 caregivers should measure simultaneously. One measures heart rate with stethoscope, the other measures radial pulse. Person measuring heart rate gives start/stop commands. Count for full 1 minute. Then take a reading and record it, such as heart rate and pulse rate, and write it down in beats per minute. Step 2. Measure respiration. Measurement method. Caregiver maintains finger position on radial artery. Simulating pulse measurement. Observe chest/abdominal movements with eyes. Note depth, rhythm, rate, and character of breathing. Watch for signs of respiratory distress. Count respirations for 30 seconds. Multiply reading by 2 for respiratory rate per minute. For abnormal breathing patterns, count for full 1 minute and record. 2. Respiration measurement notes. Since breathing can be consciously controlled, no specific explanation is needed beforehand to the elderly person to avoid causing anxiety, affecting the accuracy of the measurement results. If the elderly person has engaged in strenuous exercise, anxiety, or crying, allow 30 minutes of rest before measurement. Do not use the thumb for pulse measurement because the thumb has its own strong pulse, which can be confused with the elderly person's pulse. Abnormal pulse or respiration should be measured for 1 full minute. For elderly persons with weak respiration, place a cotton ball in front of the nostrils. Count the number of times the cotton ball is moved by exhalation.